So
Okay, we've started the recording.
good evening, everyone. Welcome to the Health Seniors Human Services Youth Education and Human Rights Committee meeting. This is our monthly January meeting. We have quite an agenda today. The first thing will be, after roll call, our first agenda item will be about language access with the city agencies, and we have guest speakers. Well, specifically, we're going to focus on Department of Homeless Service, and we have guest speakers from the Legal Aid Society. That's the Homeless Rights Project. Our second agenda item will be about data disaggregation. That's reporting out data disaggregation, disaggregated data from city agencies. There is a law, there's a lot of advocacy being done, and community board always needs data. So we have a guest speaker from Lloyd Feng from the Coalition of Asian American Children and Families, who will speak to us on that. And then finally, the third thing before we leave is we are going to work on a letter of appreciation for the services that are to be provided by Care for the Homeless at the Safe Haven at 91 East Broadway. As you all recall, we heard a presentation from them back in November, and there was interest in sort of memorializing something about the services that they will be providing and how they're needed. Okay, so before we begin all that, though, I will hand this meeting over to Larissa Shaneberg, who will explain to us the procedure of the meeting.
Hi, good evening, everyone, and welcome to the Community Board Health and Human Services. I just wanted to advise everyone, first of all, that this meeting is being recorded. If you are not a committee member, we welcome you to sign into our meeting via chat to keep track of our attendance. And if you, and during the meeting, if you wouldn't mind, please remain muted unless you are recognized to speak to reduce background noise. Our chat this evening will be used for distribution of materials and technical assistance and sign in. So if you are experiencing any technical issues, reach out to me via chat. I'll help you out. But otherwise, we're not going to be posting anything in the chat other than materials, technical issues. Wow, I'm so tongue-tied tonight. Materials, technical issues, and attendance. So thank you and welcome to the community board meeting.
Okay, thank you, Larissa. Okay, so before we start, we will take attendance. I also, I emailed the minutes of the last meeting to everyone. Are there any changes to the minutes as you receive them? If so, please raise your hand and let us know. Okay, since I do not see any hands raised, that means that the minutes are approved as they are. So then in that case, Heidi, can you start the attendance?
Sure. Maylee.
Here.
Thomas Rosa.
Here.
Larissa Scheinberg.
Here.
David Crane.
Here.
Eric Diaz. Shirley Fennessy.
Here.
Deborah Glass.
Here.
Alicia Coleman.
Here.
Laura Lugo.
Here.
And next is me, Heidi Schmidt. Ricky Wong.
Here.
And Carmen Perez. And then I'll just come back to Eric Diaz. He's not here, right? Okay.
No,
Got it.
don't see him in the meeting.
All right. Thank you.
Okay, thank you, Heidi. Okay, so we'll just go ahead and start with our meeting. Our first agenda item, which is language access at the DHS. And we have our two speakers here today. That's Beth Hoffmeister and Gabby Torres Lorenzotti from the Legal Aid Society. Welcome to the meeting. And we looked, well, I passed the committee your text of the executive orders that that currently exist, but maybe if you can just talk about the rights to translation and interpretation when it comes to the homeless.
Yeah, sure. So thanks so much for having us, and in general for all of your kind of community board that's known for being very supportive of legal aid's clients in a lot of different capacities. So thank you all for that and inviting us today. So I'm Beth Hoffmeister. I'm here with my colleague Gabby. We both work at the Legal Aid Society's Homeless Rights Project. Just as an FYI, we do operate a hotline that if you ever run into someone who may be having legal issues, is a place that they can call to get advice regarding perhaps not being able to enter shelter, or perhaps they need accommodations related to shelter so they can safely live there, things like that. You should always feel free to pass that along. And I know the chat is being used for administrative items, but we can make sure that that gets passed on to you all, our 1-800 number. We passed along kind of some of the legal basis for things that DHS, the Department of Homeless Services, should be doing in regards to making sure all clients who are receiving services from them have access to appropriate translation and documents that they can read, quite frankly. Most of the obligations for DHS come out of a law that got passed when Melissa Mark-Viverito was city council speaker in 2017 called Local Law 30, which requires all city agencies to identify somebody at the agency who's responsible to come up with a plan for how they're going to provide language, all their services in a way that all clients, no matter what kind of language they speak, would be able to access it. It doesn't require them to translate every single document. It requires them to translate documents that are kind of most commonly used, but they do have to provide at a minimum telephonic, if not in-person, translation services for folks for frankly any kind of interaction that's happening in regard to them receiving services. I know that May and Susan mentioned that you all are particularly concerned about what's going on with your unsheltered population in your area, so folks who are interacting primarily with street outreach. And it's really interesting, actually, because I went back through the local law today before I got on the call with you, and so many of the ways that people are notified of their rights to have things in their own language and translation services are like posters that are put up in spaces. And obviously right now in general, because of COVID, people aren't in spaces together the way they were before. And particularly if you're someone who's sleeping out on the street, you aren't, there aren't posters like out in the neighborhood explaining that you have.
It's a little hard to hear you.
It's hard to hear me?
I'm not having any problem at all.
There's no issues here.
Yeah, I think it's you, May.
No, I think we're fine.
Okay.
Oh, it's me. Oh, yeah. Okay. Go ahead.
Okay.
No problem.
I think one of the things that Gabby and I are hoping we can, set up with you is if there are people and clients or folks you come across that are having difficulty or not having, are meeting with outreach workers who are not engaging with translation, even over the phone, because DHS does have the ability to have telephonic translation. They have a contract to do that. That's something we can definitely follow up on. We sent a demand letter at the beginning of 2021 to the Department of Homeless Services stating that we were getting several reports. And to be honest with you, most of the clients who were reporting issues speak Spanish, which, to be quite frank, is like a very common language that, a lot of people speak here in New York City, let alone clients sometimes who speak Russian or Haitian Creole or something that is common, but not quite as common. A lot of the complaints we were getting were from clients who were preferring to speak in Spanish during their case management meetings and things. So We did send a demand letter, and DHS very quickly fixed pretty much all of the problems from like a systems level that they can, but we never received any kind of complaints from street outreach, which is common because clients, it's more difficult for them. We don't always connect with them as easily. Because, they don't always have access to a cell phone that works or something. And it's during the pandemic, it's just been harder to connect with those folks in general, those clients. So we're very interested in figuring out if there are ways or circumstances where you all are coming across clients who aren't having translation services or aren't receiving documents in a language they can understand, that we absolutely can follow up with that, because we've already established a line of communication with their DHS leadership about language access issues. But more importantly, we want to make sure that if there needs to be further conversation with the nonprofits that contract with the Department of Homeless Services to provide street outreach, particularly in your area where I can imagine there's a large population of folks who speak Cantonese and or Mandarin, and those are services that may not, or those are languages that may not, they may not have outreach workers that speak that there needs to be a concerted effort to ensure that folks who are doing street outreach in the Community Board 3 area can speak the languages of folks who are on the street who may need translation service person to person, which is obviously always preferable to phone translation. Gabby, I don't know if you want to jump in with anything.
I think you covered, no, I think you covered all the bases. The only thing I'll add is that from a sort of, from DHS's perspective, the onus for contracting with sort of a language interpretation service is first on the provider, although they've said that they have mechanisms to support providers who may not have those contracts already established. So, we'd love to hear from you too, if you're saying that the issue is maybe the provider doesn't even have access to an interpretation service. And that's, again, something that we would flag and hope that they would reach out to DHS and their language services office to establish that line of service. I don't know if there are any questions or.
I actually looked at DHS's report. They're obligated to provide a report at the end of each fiscal year. So they provided it in June of 2021 about the prior year's kind of language access kind of documentation of when services were used. And there were the highest number of street outreach translation requests were for Cantonese, and the second highest, I believe, was Mandarin, and then Haitian Creole. So, or maybe Haitian, I would have to go back and check, but like it's clearly, but there weren't that many. It was only 7 and 6 that were documented. I'm sure there may be more than that happening that may not be documented in their report, but again, if there are ways that we can just alert the agency that you all came to us and we're just concerned that these services don't largely exist for your the population of unsheltered folks who live in your area, then we're very happy to reach out and we absolutely will help out with specific cases and everything also. And we realize you may not have one today, so we'll make sure that you have our contact information. And actually our colleague, Catherine, who couldn't be here tonight, is kind of our lead on language access issues in our unit. She just wasn't available today, but we'll make sure you have our contact information collectively so we can support you and the community members who are living unsheltered in your neighborhood also.
Susan, you had a question.
Well, a few things. One, I'd like to know the counts you got for requests for the different languages. I'd like to know, are those aren't from Community Board 3, are they?
Oh, sorry, they don't list them out by community board.
So that's the exact kind of problem we have. These requests are totally useless if they're not from the community, if they're not by district, because we're not interested, and for our district, we can't deal with the needs of people, say, in Flushing or Astoria. So we don't need help in reaching out to the agency. We work really, really closely with them. We have the best Goddard outreach that they're amazing. They do have access to the phone line that has been successful. It is not optimal. It's not culturally competent. What we need, I think, is laws requiring better resources than we have. It's very hard to get Chinese translation out with the street outreach workers. I am currently trying myself to outreach to nonprofits to see what help we can get. Those resources, you know, the DHS seems to be happy to say, here's a phone line. That's not adequate. You know, that is happening. They do provide the phone line. It's not adequate. And I think what we need to recognize is that a lot more than that must be required. And it must, the data has to be by district. It is totally not useful if it's not by district.
Yeah, just as an FYI, we don't get any data by district, either in reports that they're required to provide to us because of litigation, or also publicly unless it's in the law. So, you know, but I understand why you would care. And I actually, to be honest with you, can kind of imagine they could figure that out. These aren't like enormous numbers, so they should be able to give it to you.
They have the information. They will not give it to us, but they clearly have it. It's the same thing with the Hope count. You know, when they count and say there's 10 people in this train station, but they won't tell us which train station.
Yeah, yes, we're frustrated by those things too. So I can affirm you there for sure.
Okay, just to explain the question and answer procedure, I realized I did not do that. I take, if Beth and Gabby, if you are finished with your presentation, then I will take questions and answers, and I will take questions first from the committee members. When the committee members are done, then I will take questions from the others, but all will get a chance to ask a question. So first of all, Beth and Gabby, are you done with your presentation?
Yes. And we're
Okay,
happy to pass on more materials if people wish to have follow-up to things we
okay,
talked
great.
about.
Okay. Committee members, any questions? Okay, this is for the language access part. You know, to
I do have a question if the committee member already done with the questioning.
oh, wait, just 1 minute, please.
Okay.
Okay, I don't see anything from the committee members right now. So Nolan, you had a question?
Yes, hi. I'm a business and a property owner at the East Broadway, and I'm very, very concerned and also very disturbed and very disappointed. Last time I saw the review, the Community Board 3, where the DHS and the Care for Homeless made a presentation regarding the proposed site for the homeless shelter. And
This isn't about.
Okay, Nolan, Mr. Chang, this is not about the
No.
specific.
Let me finish.
This is only about translation.
No, I understand. This is what I'm leading to. At the meeting of last time, there was no translation. Our community consists of all the new immigrants. And also, because lack of communication, there was lack of community engagement. That's the point I'm trying to make. Same point you're making, Susan, that it is a very concern. And I'm very, very
okay,
concerned.
Mr. Chang, obviously you do not need translation yourself because you're talking to me completely in English. But right now we are talking about translation for the clients of DHS and their shelters. So unless you are a client, you can ask a question, but if it is not related to the client, we will move on.
Okay, thank you.
Actually, I had a question about, I just want to know how we can move forward with what Susan is talking about. Because, you know, our immediate problem right now is that, you know, we have the safe haven with, you know, these services, but the way you enter the safe haven is through the street outreach. You know, they're referred by the street outreach team who doesn't, you know, who needs more of the, you know, competent, you know, culturally competent, linguistically competent staff members to do outreach. I mean, their teams are very small, so it's, they just need more people and more funding. So I do want to find out later, if you have any ideas about how we can advocate for that. Is it just budgetary or and all that? I think that would be tremendously helpful.
Yeah, I mean,
and then we're talking about it specifically, well, like you said, they don't have cell phones. You can't just hand them a phone and talk to someone over the phone. It doesn't work that way with them. So, if you have any thoughts on that now, or maybe you've been, thinking about it.
Yeah, we work, in Midtown, there's another community, they're not a community board, but it's it's like a business community district group that gets together, and also around Grand Central, that just reach out sometimes to brainstorm around how they can better provide support. I mean, I think anytime any kind of community group, especially a community board that's organized, can step up in support of an organization in their neighborhood to help get them funding and advocate directly with the agency, in this case, the Department of Homeless Services, that is often very meaningful and can make a big difference. As much money is spent on homeless services in New York City, which is an extraordinary amount of money, the reality is most of the nonprofits who do that work are understaffed and underfunded. And so I think coming up with a very clear proposal about why your neighborhood needs something specific to best serve the folks that are there, and we're happy to talk to you more about that kind of outside of this meeting, is a beautiful idea, and I think would go a long way with the agency, and with if particularly if you're working with the nonprofit to add, to support their own advocacy to get more funding, that is very helpful. We also have relationships with the organizations called Homeless Services United, which is it's all of the homeless service providers who have contracts with DHS are kind of in this organization together so that they can share ideas and support each other and provide better services. And we have a relationship with that executive director, and she may also have ideas that would be helpful based upon how she sees other members across the city advocating for more funding for their client populations.
Okay. Yeah, so we'll continue that conversation. Susan?
Well, mine was very much on the same line, is how I think the group you're talking about is John Mudd's group in Midtown. And, we're all just kind of frustrated. We work with him, and we're all just kind of frustrated in knowing what needs to be done. I don't think DHS is very open to hearing about new ways to spend money that would be helpful to us. And, I think, we can figure out strategy offline, but I think getting organizations like yours, first of all, people aren't talking about translation on the street. I see very little about it. And if the other people are talking about this, I think it needs to be amplified so that more people are aware, and that we need to have systemic changes made. And I think as far as the data by district, which we'll also be discussing later, again, I think people that are asking for data and they're asking for better breakdowns, but they're not asking for it by district. And I think that has to be amplified.
I'll also just add sort of from our sort of advocacy perspective, what's always the most useful and powerful are individual client examples, which I know can be challenging, especially with an unsheltered population. But, a lot of the work that we've done sort of advocating on the language access issue has come from sort of countless examples of where it was not working previously. And so, if to your point, if there's a flaw specifically with the language, the telephonic interpretation, and for your population, you're saying that, we really need more funding for in-person translation. I think the individual client examples are going to be key here, because that just seems to be how we do our advocacy and what gets the ball rolling in terms of getting some of this stuff done.
And that's helpful.
Okay. Paul Rangel. You had your hand up.
Thank you, Madam Chair. I'm just going to go in a little bit different direction. I apologize really quick. I just want to remind everyone that if you're on this call and you're a board member or committee member and you're representing another organization, you could be in conflict of interest. So be careful of all that stuff and be mindful of that. That's all I wanted to say. Thank you.
Okay. Jackie.
Hi, May, and everyone. I'm Jackie Wong. I'm representing concerned citizens of East Broadway.
You can't.
I agree. I agree with what Susan said, that the data is useless.
Jackie, you cannot represent another group. It's a conflict of interest.
How is that a conflict of interest?
Because
I'm
the
not
conflict
speaking.
of interest board says so.
The board says so what?
The Conflict of Interest Board has said that.
Says that no board, no more.
Can you explain the conflict?
The Conflict of Interest Board says no board member may ever represent another group at the community board.
Not on the committee level?
Committee or full
Sure.
board level.
Okay, thank you.
You're welcome.
Right. David Crane.
I'm curious, does that also apply to public comments? Because we always let board members do that, or is that changing?
No, they said public announcements. We have it all in writing. We asked very specifically, and they said public announcements during public session were okay, but not at otherwise.
But why?
If you want to know why,
Ms.
you'd have to
Gutierrez can speak.
you'll have to contact.
I just feel like that happened multiple
Jackie,
times.
just,
in the
okay, Jackie,
past.
why don't we just put, okay, that's what they said, and you'll just have to take it up with them later, okay? But we can't do anything about it now.
If you like, I'll send you the link for them.
All right, I don't see any other hands raised right now.
I
It
want to
looks like-
speak. I'm sorry.
Can you need to raise your hand? Okay, I'm looking at the raised hands, so
Oh,
or you're not able to.
Yeah, I cannot.
Is-
No.
Derek Day wants to
Derek.
that's me.
Okay, Derek.
Actually, I want to see, other than, provide translation to the people, in the shelter, maybe we should provide a translation service to the whole community. Let the whole community, knows what's going on. Because most of the people in the community, they feel they are blinded. They are not.
Okay,
well
Derek,
informed.
Derek, I said that this meeting is about translation services for the clients of the shelter and of the Department of Homeless Services. Okay, that's another discussion for another time. And
Okay.
again, I can see that you don't need translation either.
Actually, I'm only the small group, so who can
Okay, it
speak
doesn't matter.
English.
I don't, well, you're speaking English now and I understand you perfectly and I know what you're saying, but that's not what we're talking about right now. Okay, so let's move on.
I'm sorry,
go
May,
into
I have
the-
another question.
has his hand raised.
I'm sorry?
Danny Zhang has his hand raised.
I can't see. Okay, there's a Danny and then there's also someone named May. So we'll take Danny first and then we'll take some May. Danny?
Okay.
Danny? Danny Zhang?
Yes, then need to keep new activity safe. I don't want, I need a now need gonna just state, we need all the New Year people, keep it safe, okay? And we need a New Year Chinatown, Manhattan, keep it safe. I don't want a 9-1, each Broadway for home. And because we need a city, make it strong, make it beautiful, okay? No, I don't need a home needs in a 9-1, each Broadway. Thank you.
Okay, all right. May? Your last name is
Yes.
Zhang?
Yes.
Okay.
Yes, I'm here. But you know why? My English level is not that much great. So I really need that. I have so many friends, you know, the laborers, they really need the translation, interpreter to get a, you know, participate the community meeting, please.
You know, there's going to be another meeting, you know, directly with DHS and service providers. So that will focus on your questions and needs. But it's not,
when
they're
will
not
we-
here. They are not here now. The decision makers are not here now. And so we can discuss, that can be discussed later. Okay, so I
Always
would
we
like
need the translator.
that will be
Mandarin.
discussed at another, yes, you can talk to them about it later. I mean, Mandarin, Cantonese, Fujianese, you know, whatever it is that you speak. Okay, so let's just move on.
How-
May,
Okay.
May,
To the
can I
next-
ask a question? I'm sorry, can I ask a question?
Yes,
Can
Jackie.
I speak on behalf myself, not on behalf of anyone? Just a resident
Paul,
who lives in the
Paul
neighborhood.
and Susan, what do you say? What does the thing say? Because
Well,
I don't have the,
yeah,
Jackie wanted to.
we were just told that a board member can never represent another organization.
Right,
That's
so
the-
I'm not representing an organization. I'm just representing myself, who is a resident who live in CD3. So I want to go back to the client translation issue. I agree with what Susan said. The data they provide is useless. And I also walk in the neighborhood every day. And I know there's one person who may need service in Columbus Park, one may need service on Grand Street, and one may need the service on East Broadway. I'm happy to help Susan if you need I mean, you just mentioned that you have sometimes you are having trouble getting the translation service. I'm happy to volunteer if you need the support. Just that.
Okay, can I speak to that, May?
Sure.
So I see Jackie's volunteered and some other people in the chat are volunteering too, which I greatly appreciate. I will go back to Goddard and see if that's possible. What we're really looking for is kind of organizational systemic resources. But I will have, there's a lot more than 3. There's a number of people in Columbus Park and several other locations that we already know about. So I will take that back. Thank you.
All right, so we will move on. I think we need to follow up with legal aid about, you know, some more advocacy for funding for a long-term solution for the translation and interpretation and culturally competent services problem that is greatly affecting us. So we can take that offline and have another discussion and then come back later. Heidi, did you have a question
I just wanted
or a
to
comment?
a comment more so. I just wanted to say too, for people who are offering that translation services, it's not only does it need to be like more systemic, but it also you probably need to be brought in.
Need to be what?
You probably need to be brought into the fold of actually working with the outreach team somehow legally, because it's not just about offering those services. There's a lot of confidential information that people share. And, you know, the outreach teams, everybody who's involved in that chain, you know, agrees to not share that confidential information outside of that. So I think it's not just about volunteering. There has to be a better system set up for that. I don't want to say the word legalistic, but something more formal in that direction, and training probably.
Yeah, that makes sense. All right, so we're going to move to we're going to follow up with this, but right for now, we're going to move on to our second item, which is data disaggregation. And it's all related. because we need data. And we have Lloyd Feng from the Coalition for Asian American Children and Families, who will speak next. Welcome, Lloyd.
Great. Thank you all so much for having me join your meeting tonight. I'm going to share my screen if that's fine. I'm just going to pop this in. 1 second. Can everybody see my screen?
Yes.
Yes, we see it.
Sorry, there's a lot of tabs. Give me 1 second. Okay. Great. So I just wanted to take the time to I think May and Susan must have circulated the 2 documents that we provided. The first document about data disaggregation should give some sort of like a brief summary of the landscape of data disaggregation in not only New York City, but New York State. I will cover some of the points in that document, but in the interest of time, I'm just gonna keep things brief, given that everybody has that document. The second document is the testimony that I gave at the Committee for Governmental Operations hearing back in November on the revision bill, Intro 1937, that I'll talk about a little bit today. But you can refer to that to look at any specific recommendations that we and other community groups developed as to what needs to be changed in the local laws. So to start off today, I'll talk about what data disaggregation is, right? So this term has been bounced around. Data disaggregation technically is when you take a larger piece of data and you break it down into subcategories that would offer like more specific information. And so in the instance of the Asian American and Native Hawaiian and Pacific Islander community in New York City, we're I think just over 2.1 million strong, according to the last census. And so, but within us, right, we have all these different ethnicities, ancestries, and places of origin, as well as different immigration histories, right? So there's a lot of diversity and disparity that the label of API or Asian just doesn't capture. When data is collected at city agencies, state agencies, with just Asian, where Koreans, Pakistanis, Chinese folks are all just this one larger category, that's not helpful. And I think from the conversation earlier, right? Data is critical, data needs to be specific, and it needs to be contextualized and targeted. And so that's what our work is focused on. Data disaggregation for the Asian American and Native Hawaiian Pacific Islander community is critical to being reached, to making sure that all of our population's needs are actually fully understood and by politicians, and that electeds then deliver on resources that our communities need. And so I'm just going to show some of these charts that were included in the Department of Health and Mental Hygiene's most recent study or report they put out called The Health of Asians and Pacific Islanders in New York City. It came out in December. In this, they have disaggregated data according to different metrics. So, on the left, you'll see varying income levels below the 200% of the federal poverty level. Bangladeshi folks, right, 58%, very different from the experience of Filipinos and Japanese, where it's 20, 23% respectively. That represents a lot of disparities. Same with employment and that kind of data on the right-hand side. Japanese folks, 67%, are in working in management and professional occupations, whereas that's not the case for Bangladeshi and Pakistani folks. So moving on, whoops. So in education, it's the same thing. If you look at just educational attainment, right, varying levels across the board. And same thing with housing, which is why May and Susan approached us to talk about data disaggregation. There isn't data disaggregation is not something that has done particularly well, even though, oh, sorry. Oh. Is there?
Oh, we're not talking about the state now. Okay.
Oh, sorry. Okay, there we go. I think I clicked a little too fast. Sorry about that. So what is data disaggregation like at the city level, right? So back in 2016, former council member Danny Drum actually was the champion of a lot of data disaggregation efforts. With his help, the city council passed and signed into law local laws 126, 127, and 128. 126 provided that 7 city agencies, including the Department of Social Services, Administration of Children's Services, Department of Homeless Services, Department of Health and Mental Hygiene, Department for the Aging, Department for Youth and Community Development, and the Department of Education. All these 7 had to collect demographic information on at least the top 30 largest ancestry groups and languages spoken in the city of New York. And then 127 mandated that these forms now had to include multiracial ancestry or ethnic origin options for people to fill out if they identified as that. And then 128 focused on sexual orientation and gender identity. And so this was a huge, huge change. But it's 2022 now, and a lot of these agencies are not fully compliant. We've been in touch with Ops, and they've told us that the form review is ongoing. There's a report that I think should be released soon, where they, their report will cover what the progress has been across these different agencies. Our conversations with them revealed that I think DYCD and I forget which other agency, but most of these, there's not enough accountability in place currently with the bill language or the law language to really incentivize these agencies to move faster on this. But that really puts a lot of our communities in a difficult position in that we still don't have that kind of granular data, that would be helpful for addressing a lot of different needs. And so included in that is the need for better data on homeless populations in different communities across New York City. And so, to that effort, that's why we are pushing the Revision Bill, Intro 1937. Former Councilmember Drum also introduced this last year, and we were hoping that there'd be a lot of movement on it toward the end of the year, but that didn't come to pass. And so we're working with some new council members who are very, very interested in data disaggregation, understand that it has immense positive consequences for a lot of communities across the city. It's important to highlight that this data disaggregation I'm talking about at the city level, it's not just AA and HPI, it applies to all communities. And so it's multiracial, multi-ethnic, multilingual. And so we're currently working with a lot of different community groups to beef up the language in the Revision Bill this time around. So that's at the city level. In terms of the state level, we had some big news last month. Governor Hochul actually signed S6639 A6896, which is an AA and NHPI focused data disaggregation bill into law. And so this is a timeline of how long it took in terms of some of the passage and the Senate and Assembly levels. But this is the culmination of 10 years of advocacy that CACF and our partners really focused on. So it was a huge win. This piece of legislation is focused on AA and NHPI, and it mandates that only the top 10 most populous Asian American groups will have specific categories for which state agencies will have to collect data upon. And then these 4 specific NH and PI groups will have those subcategories. And then they'll also collect primary language spoken at home. There's a stipulation that the agencies will have to submit their data to the public on an annual basis. And they offered a timeline for different agencies. What's critical here to this discussion of data on homeless populations is that the Office of Temporary and Disability Assistance, I think, houses, the Division for Homeless Services or something at the state level. They have 3 years to comply, which is slightly longer than most other agencies, which is they have 2 years. And so that's a difference. We're still, working on developing relationships across these different agencies to get a better sense of what the implementation process will look like. And so that's where we are at the state level. At the same time, I just wanted to very briefly talk about a project that we're working on at the state level with the Department of Health. Former Governor Cuomo actually provided $3 million for a research effort between CACF and our partner in the NYU Center for the Study of Asian American Health to better understand what data disaggregation could look like at the DOH level with some of the DOH data sets. So this project we kicked off back in, I want to say October, and we've been working with the DOH. It's been quite slow, to be honest, but we're working with them to look at how these data sets and the different categorization that is currently that the DOH currently uses for some of the data sets could be improved going forward. And so this is a process that we hope to have more updates on this year. And I think that is all for now. And I'll take any questions people might have. And, oh, sorry. In terms of next steps, or in terms of things that CB3 can do, where we can be aligned, is I think it'd be very useful for us to work together in terms of messaging on data disaggregation. This is a real need, a use case, in terms of how CB3 and the community needs better data on who is housed, who's unhoused, what those needs are. And so agencies have told us that they need to see what the use cases could be for such data for them to start building that kind of the categorization or these changes into their databases. So that kind of, if in conversations with agencies, if you tell them what that use case is, that would be very helpful. If you are in meetings with us about data disaggregation and agencies, that'd be also very helpful. So we're very interested in working with the community to really show agencies where the needs are for data.
Okay, questions and answers, first from the staff or the board or the committee members and other people afterwards. Well, Susan, Stetzer.
Sorry, I always have questions. So none of your work has been about breaking it down into communities. And it's not just street homeless that's needed for. If you're going into any community, whether you're working with seniors or anything, you have to know what's needed in that community. It's like you're not going to tell all outreach workers they must have Russian translation and all these others. And one is, would you consider adding that to what you're lobbying for? And I'm curious as why that's never been done. I'll give you an example with COVID. Department of Health in the city was working with the community boards and asked us at one point last year, when it was still very bad, to help with outreach into areas where residents had not been vaccinated. And our answer was sure. We have very different communities within our area. Tell us which areas have high and which have low vaccination, even if we're going by zip codes. And they refused to give us that information. I know New York One tried to foil that, and some other groups tried to foil it. I don't understand the problem. Why is it that they won't give it? And why is it that this hasn't been part of the advocacy?
Thanks for your question, Susan. Can you repeat again, like which part you're wondering hasn't been in the advocacy? I think I might have missed that.
Asking for the breakdown by community, asking for the breakdown by communities.
Yeah, I think that's a great suggestion, and it's something that we previously didn't do, and I think that was definitely an oversight on our part. We'd love to partner with community boards. I think before I joined the team, our team was very small, and I think there wasn't enough bandwidth to explore building how many community boards within the city, right? There's so many, they all have these very unique needs.
59.
And I think there we go. Very understaffed, and I think to take that on, and I think that's a wonderful suggestion. And our team has actually, since we met with you in May, we have started thinking about like community boards a lot more and thinking, how best can we work with you and your peer community boards to understand like where our mutual needs are. So we're happy to continue that conversation. We're really we'd love to be on conversations at different agencies with you all. We'd love to bring you in. So we're very excited to work with you.
On the committee members on data
Yes,
disaggregation.
I have a
Nation?
question. I'm struggling with my
Heidi?
hand, yeah. I guess, are we, in having this conversation, are we trying, like, what is our, I guess, our goal in terms of getting or starting this conversation regarding data? There are definitely some things I can see that we would want to know. For example, people who are sleeping on the streets, which language do they speak, so that we can actually get people who speak their language to go out and speak to them. But like, what was our original thoughts, I guess, about starting to work and collect with this type of data?
Well, it would help us right now, but we don't have it right now. It would help us if we have that right, to sort of determine what needs to be done. But what exactly needs to be done in our community when it comes to the street homeless. And, I also, but there's also this long-term thing that we should probably get involved with. And what, actually every year the agencies, this whole data disaggregation thing, the way it's supposed to be implemented, it's very like multi-step. The first step is to have a form that you can collect data on. And then these agencies are supposed to report about the form that they've developed or adapted in order to collect the necessary data and the procedure with which they're going to do it. So they have this annual report. And actually, I think it was maybe it was someone from Legal Aid who actually looked at the annual report for DHS. And there were many forms that they used that were deemed sort of not necessary to be reported on, except for the one where it's like the YCD refers to DHS and did not account for, it accounted only for a very small portion of DHS clients because the clients come in other ways. That's not the primary way, or not, it doesn't count for a lot of people. So there's like a loophole there. And I recall, Lloyd, you mentioned that this new intro 1937 is to maybe, should I call it a loophole or to close, to strengthen something?
Yeah.
Is that what it's called?
Yeah. I think that makes, you can definitely say that. Yeah.
Okay. So, but that's not going to happen like tomorrow. But it would definitely be useful to us. And then what I would like to know is what can we do? Is there something immediate that we can do now to get the data we need now, this year? So, I mean, we can, advocate on the long term. And then Lloyd made a request, about kinds of examples or cases that are needed. And also you mentioned the necessity to work with a new city council. Well, our city council member is new, so, it wasn't, so, he'll have to be, brought up to speed on this as well.
The one thing I'm thinking about, and that's kind of why I was asking for more clarification on it, is that, I know that there is a lot of resistance to these safe havens that are going up in the next couple of years. And if, 2 years, or I guess it's maybe 3-4 years ago, we were saying the opposite, right? Everybody was out crying in the square where people were killed and saying we need people who speak the language and who can be housed here. And if we had the appropriate type of outreach and services, that they would perhaps have come in to shelter and been safe. So what I'm wondering is if we can use the data that we would collect for people on the street to help to show that people are from this community, that they speak languages in this community, and that these folks are the ones who actually need help. And that's not to say that we shouldn't help people who don't speak a Chinese language. It means that these beds in particular, safe haven beds, are for folks to prioritize the safe haven beds for them, for example. I would hope that that would kind of help the community members who are resistant to some of the safe haven beds to kind of understand that that resistance led to some tragic consequences a few years ago.
Yeah, it was in 2019, I think, not that long ago. It was before shutdown. Susan?
Well, to speak to Heidi's last comment, that's exactly one of the reasons. And I actually, for CB3, I've actually did get that information from the outreach. DHS won't give it to us, but the outreach people will. So, so we do have that. But just to go into why do we need this data? The example I gave with the outreach for COVID vaccinations, where, you know, they want our help in reaching out to people, but won't tell us where those people are, even though they have the information. I would say in assessing all of our district needs that we do every year, to have that information for relevant to our community would be extremely important.
Yeah, I mean, I agree. I mean, this is not just, I mean, we're talking about it right now because we have this immediate need, but it's really the whole board could use this, I bet, and each committee could use, you know, more disaggregated data. You know, sometimes we just have to like extrapolate stuff, you know, because we don't have enough of it, but, you know, it would lead to, you know, a better assessment of our needs. So, so there's the long term and the short term, but if we, Heidi, you were talking about, you know, Susan, you said you have some information from the outreach teams about.
Yeah, I don't have it here, and I actually,
No, okay.
but I do have specific numbers, and particularly in locations, to show that there are people on the street who do need translation.
Okay, and you know, to me, even if the numbers are small, that's okay, because we don't want to wait till the numbers get bigger, right? So, you know, even if a few is a few already too many.
The total was, I think, between 12 and 20 something, you know, that because some of the people still needed to be evaluated whether they were actually homeless. But it's very difficult to do when you can't speak to them.
Okay, yeah, I agree. Any other committee members? Okay, so we'll go to Samantha Chan. Samantha?
May, can
Samantha?
I share something?
Hi. No, wait.
Can you hear me?
Yes, I'm Samantha. Yes.
Yes,
I see
hi.
Samantha's hand raised.
Yes. Hi, my name is Samantha Chan. I'm a CPA. I'm also a business owner and a property owner on East Broadway. I think collecting data are very important. So with that being said, I have a question. Does anyone has a data of how we're going to spend? How does Care for the Homeless going to spend that $337 million on this shelter on 91 East Broadway?
We're not talking about
that.
We're talking about data collection in terms of demographics and population. We're not talking about their budget.
Okay, so are we gonna, at some point of this discussion, are we gonna go into that?
No, we're not.
We're not?
It's not on the agenda.
Okay, so then curious question, does anyone here knows how we're gonna be spending these dollars? $337 million.
That's not here for discussion today.
No one knows.
That is not being discussed today, and that's not the number that I know. Okay, so we can throw out numbers about the budget, and you know that it could be $3 million, could be $300,000. I want to know over what period and what it's for and what's being spent on. But we're not discussing that today. Thank you, Samantha.
Oh,
but thank you for your question. Okay.
I have another question then.
One more question.
Okay,
Samantha?
So you said that, yes, I'm sorry. You're saying that there's just a number throwing out. So do we have a number or do we not have a number?
We are not discussing money today. We are not discussing the service provider's budget today. So you're asking a different question. All right, so let's move
I
on.
think of something.
Okay,
else.
so are there any, okay, I'm not taking any more questions on that topic, just to be clear to everyone. Okay, we're talking about data disaggregation as was presented by CACF. They gave us a presentation. We have some next steps. We're going to talk about some are long-term and some are short-term. Okay, anything else? Committee members?
Yeah. Okay.
Committee.
I'm the
Committee,
okay,
I didn't
share?
call on you, May, I did not call on you. Okay, I call on you first and then you speak. First, I want to hear if there's
Okay.
anything else from, okay, great. If there's anything else from the committee members regarding Lloyd's presentation, questions about follow-up or things that we need to do to further what we need. Okay, I don't hear anything. Any other questions? Oh, wait, who's from the committee members about this? So we will, oh, I see all these hands raised. I don't know if they're from before. Is other people? If you don't have a question, put your hand down.
Hello, I do have a question.
Wait, 1 minute.
It's
Okay,
only
first it's, okay, May, Jackie, and Nolan.
back in May.
Hello?
May? Yes, May John?
Yes. Okay, yes. Can I share something for the safety issue in the East Broadway?
The safety issue?
Yes.
We're not talking
Community safety issue.
We're not talking about that now. Thank you,
But
anyway.
How
We're
can
not
I-
talking about that now. You mean the
So
safety
you-
of whom? You mean the safety of the homeless?
Yes, the homeless people and the shelter in the East Broadway, you know, the Henry Street.
It's not
Okay,
on
let me
Henry
sh-
Street.
No,
I don't,
Right.
you know, why don't you get your question straight? Okay, if you do, we'll get back to you. Jackie.
Thank you, May. My question is regarding the numbers, the data. First of all, I support the disaggregated number. I think that those data are really important in many ways. I don't want to spend too much time on it, but I want to ask Susan, you mentioned that the numbers you have is between 12 to 20, and this center, 91 East Broadway, is going to build for 120. And I think what we miss is that, like in total, Chinatown already has 5 existing shelters, safe haven, or such facilities, and 3 more are in the pipeline. So altogether, I mean, if you look at Councilmember Chin's letter, she said the neighborhood is already saturated. So how do we like make that argument if the need is there? I mean, we already provide more than enough of the best.
Okay, so since you're,
So
since
let
you're.
me finish it. Can I finish it? And also, I wanted to, since we are also talking about others, I want to say that the people's concern is because if you look at last year, the Asian hate crime went up by 361%. And then if you read a New York Times article in April, and it says that majority of the hate crime were caused by homeless individuals who are mentally distressed. And also, if you read any news article, it says that 50%.
Wait, I'm sorry, is this about the data? This
Right,
is
I
not
understand
about
that,
data.
but since you want to talk about numbers, that's why I'm
No,
saying
we're
that.
not. May, can you
Okay.
share this meeting around the issue? Because this, if you want to
This
ask
is-
me
okay.
questions about this issue offline, Jackie, that's fine, but that is not this discussion right now.
Okay, all right, that's all I have. Thank you.
Okay, very good. Okay, so to be clear, this is about Lloyd's presentation on disaggregated data. Okay, it's not about the number of shelters in the community or facilities in the community or what services we have. It's about the data. Okay, so if your question is about that, fine. If not, it is for another time. All right. So May, did you figure out your question?
yes. Actually, okay. I'm really concerning about the 91 East Broadway to be the shelter. it's
We're not talking
actually
about-
unsafe for the community. But everybody has the right to make sure they every day go out, it's safely on the street, safely on
Okay,
the
that's not what
subway.
we're talking about. That's another conversation with the service provider. They are not here today. I'm not going to entertain, I'm going to cut this off right now. Okay, so I'm going to end this part of the agenda. I'm sorry, Lloyd, if you have, we can follow up with you. There's a lot of things we need to follow up with you on in terms of action, in terms of the 1937, and then maybe our immediate need. If you can help us with that, that would be great. Or maybe Susan has the information. Okay, so yeah,
Just
Lloyd?
talk about,
Oh, Susan.
yeah, could we just talk about maybe doing a resolution at another time with this information to support it?
Oh, yeah. Okay, so we had talked about it a little bit before, having we're not going to have one tonight, but a resolution at another time to support the legislation, perhaps, the 1937. We, like I said, we have a new city council member, who, we have people to advocate to, city council members. Maybe there's a committee. I don't know if it's government ops or whatever committee that. So we passed well, if we pass a resolution, it's something that we could use to advocate to, or write letters about it. So we could do it in February. But in between now and then, we would need some information and language about what we're doing. And then in February, so the timeline is that at our February meeting, we'd have, we could possibly have a draft, resolution or letter in support. And then if the committee votes to pass it, it would have to go to the full board to end of February, so that there could be, if it passes, then there could be something at the end of February for us to advocate for. So actually, it sounds like you're just starting, right? So is that a good timeline?
Yeah, I mean, I think we can follow up offline, but we would be very interested in that. I think it makes more sense. It first makes sense for us to work with our city council champions to reintroduce that bill first before the community boards put out their support, because I'm not even sure if it'll be called Intro 1937, given that it's like a fresh legislative cycle. But I will be in touch. But thank you for making that a possibility.
Okay, so you're saying it might be later. It might not be February, maybe too early, is what you're saying?
Right. Yeah. Because
Okay.
they're just getting their bearings in council, right?
Yes, they certainly are. Okay. Well, thanks. Okay. Well, we'll discuss more offline.
Great.
Okay. Thank
Have
you.
a good night.
Okay. Good night. All righty. Okay. So here comes our third agenda item, which is our letter of appreciation to Care for the Homeless. I know we heard the presentation in November. We talked about it a bit, doing something to memorialize about the services that we heard. I think committee members received a draft. And Heidi, you have the draft that we could show and we can discuss. So if we, it's in the form of a resolution. And also, it's a way to hold them accountable as well. This is what you said and be provided. And, and to see that if this is still being provided, since it'll be quite some time before, the safe haven actually happens. So there's still a long way to go. So let's see. Does everyone have, for the committee members, do you have it? You can open yours, but Heidi can also show hers. If we have any revisions or any changes, we should talk about it now, and then we would need to vote on it. Okay, so for the committee members, do you have any comments on this?
May, this
yes.
is Larissa. Yeah, this is just two things. One is just a typo in the last paragraph, therefore be it resolved. It's boards 3, there's a 3M, so the M should be removed.
No, it's 3 Manhattan.
Oh, so we are leaving, okay, 3M, okay. Sorry, I thought that might be a typo. I just have a suggestion on the second line, that the care of the homeless will provide an excellent program of services. I just thought that it might be a little stronger if we if we take out excellent, because that's really can be an opinion. It's not really, we think it's excellent. We think it's great, but I have a suggestion for changing that to the language could read, provide direct benefits to our community and the community at large, just that it directly benefits our community, instead of saying provide excellent programs and services that would directly benefit the homeless in our community and the community at large. I think that might make it stronger.
Oh, can you give the exact wording and then
I think there's something wrong with the document that you're showing, because it shows lots of deletions and everything. It's not what was sent around.
Oh,
I think maybe if it went into a Google Doc or something.
Okay.
It's in a Google Doc right now, but I'm putting it into a Word doc.
Yeah.
Yeah, and then when you put into Word doc, accept all the changes.
Does this look better? The Word doc?
I can't see.
Drag it over to the other screen. Yeah, unshare this one and then start sharing your other window.
Got it. Give me 1 second.
Yeah, Google Docs are horrible.
Yeah.
Which one? I have like 15 pages open. Maybe this one. You see this moving?
You have to, why don't you do a new share or unshare or share, unshare and share. Okay, now go to the.
I just did that, May. So what I'm asking is, can you see this now? The new one I'm sharing.
Oh, I don't know about the others.
I can see it, but it shows the track changes.
Right.
But we don't want the chat.
We don't want any of that. We just want the Word doc that was sent to everybody.
Yeah, just accept all the changes. Because I forgot to do that.
Yeah, I don't know. My computer's frozen or something now. Not giving me anything.
Should I email you something again?
No, I don't think that's what it is. Unless you have one that is already, the track changes are already done.
Yeah, the one that was sent at the.
Do you want me to? I have mine up on my other screen. I could share it.
Yeah, go ahead.
Okay, Larissa, you're going to share it, something.
I'm going to try. Hang on, hang on. There we are. I'm used to Teams now. I'm not on Zoom as much. Okay, let me know if you guys can see it.
Yeah, that's better.
Okay, great. So I did drop into the chat my suggestion for the last paragraph. Everyone should be able to see that as well.
Oh, so you want to leave in the word excellent? But suggest an excellent program that will directly benefit homeless, bedded in our community and the community at large.
I go back and forth on keeping excellent. Again, I think it's kind of opinionated, not very qualitative.
I actually agree with you.
Yeah, but
I
I
don't know
thought
what others think, yeah.
my verbiage was a little stronger because it shows that this will that it's not just the homeless that are being benefited, it's those who live directly in the community and the community at large. I think we want to highlight both benefits for a
Okay, so why
facility
don't we
like
do,
this.
okay, so why don't we do this for now? We'll just insert the suggestions and then all the suggestions that we have, and then look at everything again at once, and then vote on it. So Larissa, are you the one to add
Yeah,
it
I
in?
can take that. So I'll take that chat, that language out of the chat and drop it in. Okay.
Yeah, just drop it in and we can review
Sure.
everything later.
Okay, super. Anything else that anyone wants to change?
Maybe you can start
wait, let
up
me-
at the top.
Sure.
Okay, committee members, okay, anything else we want to change for our people? None of the committee members have any changes? Can someone speak up? I mean, did we do such a great job that you just like it as it is?
Congratulations.
Hey, may I interject?
Yes, Paul.
Maybe you want to read through it a little bit, just so everybody has an understanding of what's being said.
Yeah, that would be good. Let me, okay, in that case, I will.
Should I make it larger, Mayor? Are you good?
No, I'm
on
going
your
to
screen?
open up another one.
Oh, sure. Okay.
Oh, okay, okay, I'll read this. Yeah, make it large. I can't see a thing.
How's that?
Okay, good. Okay, so whereas on November 4th, 2021, Care for the Homeless presented to Community Board 3M its proposed programming for the Safe Haven site planned for 91 East Broadway. And whereas safe havens are small-scale transitional housing settings that are most successful in engaging challenging unsheltered homeless populations. And whereas Community District 3 has seen an increase in the number of adults experiencing homelessness who do not accept services in larger shelters or outside of the community, and need supportive services such as those offered by Care for the Homeless that will provide a pathway to permanent and supportive housing. Whereas the priority placement for beds in this facility will be from unsheltered people in the community who often will not accept beds and services in larger shelters or outside the community. And whereas Care for the Homeless, can you scroll down? Whereas Care for the Homeless will provide services designed to be a first step towards helping individuals experiencing homelessness to accept services and transition off the streets to permanent and supportive housing. The program will include 2 housing specialists who will work with residents on permanent or supportive housing placements. And whereas the program will include a federally qualified medical and mental health center in the facility to reduce barriers to access health services for both the residents and the public experiencing homelessness and unstable housing. The goal of the health center will be to address health needs to exit homelessness and will include primary care, dentistry, optometry, podiatry, behavioral health. And whereas the program will have a coordinator who will oversee therapies to engage residents, job training, case management, and will include a shelter director and director of social services, a community benefit specialist, a substance abuse specialist. And whereas the facility will have its own robust security, including safety monitors and about 6 security personnel at any given time will walk around the building itself, as well as monitor CCTV cameras. Whereas there will be a community advisory board to ensure that impact on the community is always monitored and that a good relationship with the community is maintained. Whereas the program will provide language access and cultural competency currently lacking in any facilities serving the unsheltered population in Lower Manhattan. So therefore be it resolved that Community Board 3M acknowledges that Care for the Homeless will be providing a program of services that will directly benefit homeless bedded in our community and the community at large at 91 East Broadway, focusing on unsheltered people in Community District 3. The Care for the Homeless Safe Haven will therefore contribute important benefits to Community District 3. Okay, that's the end of it. And that included the change that Larissa wanted to suggest. Any questions about this? Any other changes? Committee members, because you're the ones who are going to be voting first.
I see Jackie's hand up.
Yeah, I see. Okay, David Crane and then Jackie.
Mine is just grammar. There's 2 places where and is at the end, and it should go at the end of a list. There's a list. The thing is, yeah, that's one of them. And they're both right there. I believe there's often a style where you write and at the end of every whereas, because all the whereases are a string of things, or are a list, but yeah, so I would now put the word and in front of behavioral health and also in front of a substance abuse specialist. I mean, otherwise you have a list without an and.
Does that apply to the one right before the therefore as well? It has so.
The so is also a stylistic thing. I mean, if we're going to be consistent, I don't really care about that, but I do think we need to add the word and in front of behavioral health and in front of a substance abuse specialist.
Behavioral health.
Yeah. We'll include A, B, C, and D. So yeah, and.
Yeah, there.
Yeah. Oh, yes. Yes.
Right. And the other one. And it may have come out the other way and it was almost it's a
Next paragraph.
unnecessary diversion.
Right here.
Talk about
And
style.
and
Yeah, thanks.
there.
Good.
Much better.
There ought to be periods at the end of the whereases that don't have them.
I agree. I can pop those in.
But the usual style that I thought committees were always used was always an and.
The usual style is semicolon and at the end of every whereas except the last one. Correct.
So shouldn't that be done then?
Yeah, probably should. We should have semicolon and at the end of each whereas. And the last one, semicolon and either the word now or so. This is purely a style.
Yes.
Yeah, exactly.
That's our consistent style.
Correct.
I have a question. They said they were in FHQC, right? So can we just use that language exactly? They're a federally qualified healthcare center. So, yeah, I mean, you said federally qualified medical and mental health center, but maybe we should, just to be clear that, I mean, it makes a difference to be an FHQC. So an FHQC that provides medical and mental health services. And then we have the list. Hey, Ricky, is that what they're called, FHQC?
Yes.
Okay.
And now there are a bunch of whereases that end in a period that ought to be changed to a semicolon and.
Okay.
Yeah.
Okay.
Okay, so can you do that later? Or
Oh, yeah, and if we're finished with changes, I can do that while you guys, if anyone else has any other changes. I
okay,
thought I would
and
continue sharing
may
and just in
change
case
the-
and some
oh,
needed to change it.
okay, whereas the
Yeah.
program will include a federally qualified healthcare center, because that's a designation, right? Providing medical and mental health services.
I'm sorry, are we capitalizing federally qualified health?
No,
No,
no, you don't have to, I think. Well, we'll
I-
find out later,
no.
but it's called a federally qualified health center.
Health center? Okay, so,
Okay, yeah,
so,
it's the designation, yeah.
so take out medical center?
No,
and mental
providing
health?
medical and mental health
Okay,
services.
providing, okay, my health center.
So,
Providing.
Mental health
Service.
services.
or FQHC, I'm sorry.
Mhm.
The, Okay, David, your hand is still up. Do you have another question? Okay, committee members, do you have anything else on this letter, or this resolution? Okay, if not, then we will take question from Jackie and then Samantha.
Thank you, May. I have one comment and one question. The comment is that I just think that it is kind of like truer to for the board to, for your board to take a position on that, because like you saw, it's going to be a community engagement process, and other elected officers as well as CB3 going to be partner co-sponsors of this community engagement. And I just feel like community board should wait until this engagement process finish to decide what you want to do. That's what I want to say. And also, like if you think about the community board previously adopted resolutions on nature and to stop the blueprint legislation, because you want to have real community engagement with nature residents, right? And you also cited that because of language and technology barriers, things are done through Zoom. So you want that nature blueprint legislation to stop. And this is very similar to that situation. Chinatown is also a very hard to reach neighborhood. And I just feel like you should protect both nature and Chinatown citizens. That's residents. That's what I want to suggest to you. And that's why I'm asking you to think about tabling this resolution, wait until the engagement process is completed.
Jackie, the engage, okay, I'm sorry, why don't you go ahead and finish?
Yeah, and my second, and then the question is that I don't know if this committee is aware of there would be a hotel investor buying this hotel with cash, and before they sign the contract with DHS. And are you aware who this hotel investor is? Is this a predator? We don't know if this is a foreign equity investor or not. I just feel like there are some information still need to be confirmed before you make this decision.
Well, the foreign investor, I'm sure, has nothing to do with Care for the Homeless.
Well,
And if it is
so the Care for the Homeless would have to lease the property from this investor, and we don't know how much we don't know if this is a predatory hotel investor. We also, especially right now, a lot of predatory investors are coming into Lower East Side, Chinatown to just grab the properties. And we also don't know how much are they paying them for their rent increase every year. We don't know if this is 3% per year or 15% per year. I'm just saying that this information need to be studied, investigated before the community board made a decision to take a position on this.
Okay, this is about the services that are being provided. And of course, you know, we're not, it's about the services that are being provided here, and to memorialize that this committee, you know, likes what they hear in terms of the services.
Like you
It
said, there's
yeah, so it is just to memorialize that and to have that voice out there. You know, our voice has not been loud enough, and we need to be more outspoken about it.
I'm sorry, Mayor,
So
I know I
this
don't
is
have my
that's
hand up. I know I don't
okay.
have
Go
my
ahead.
hand up. I'm going to
Mhm.
interject. I'm going
Okay.
to suggest that you move to a vote if there's no other questions that are concerning.
Okay. Yeah. Okay. Okay. Are we ready to vote? Okay. So Heidi, you have the list, the committee list in front of you. Thanks, Paul, for the suggestion.
Mei Lee,
Yes.
Thomas Rosa,
Yes.
Larissa Scheinberg,
Yes.
David Crane,
Yes.
David Crane,
Yes.
Eric Diaz, absent, Shirley Fennessy,
Yes.
Deborah Glass,
Yes.
Alicia Coleman,
Yes.
Laura Luco,
Yes.
Heidi Schmidt, yes, Ricky Wong,
Yes.
Carmen Perez. Carmen?
She was here.
Hi, yes.
Okay. Okay, it's unanimous. Do I need to give you a number or anything, May?
No, just mark down the attendance and it'll be in the minutes.
Yep.
And so it was unanimous for everybody who was here, right?
Yep.
All right. Okay, the resolution passes on to full board. Okay, so our next agenda item is CAB reports and CEC reports. Larissa, did you have anything to say about the CAB? Or Ricky, did you go to a CAB meeting?
Yes, in December with the New York Presbyterian Lower Manhattan. Do you want me to report now?
Yeah, if you have anything to report on.
They just brought up a couple of things. They met at the beginning of December. So that was right at the beginning of when cases of Omicron were becoming more prevalent. So they had ensured the CAB that their staffing levels were, at their peak. And they were, they felt that they were in a better position to address, the oncoming, concerns about Omicron. But that was at the beginning of December. The only other topic that was brought up, and it was mainly brought up by CAB members, not New York Presbyterian Lower Manhattan, was that some CAB members expressed concerns about recent rhetoric against, having, representation and also housing for homeless in the community. I think the two examples that they have brought up was the movement of the men's homeless shelter down to CB1 on Williams Street. But then they also had mentioned the safe havens in CB3 as well too. And NYP was quick to indicate to the CAB members that they were a facility that provides clinical services, and generally that's, this is not their kind of forte, but they do acknowledge that they do service a lot of homeless that come through their ED. So they may hold a separate meeting with CAB members to kind of have further discussions about this as well too. But again, this is what, this is brought up by CAB members, not NYP themselves.
Oh, okay. Oh, I didn't know that. Okay, it's interesting to know. Okay, thank you, Vicky.
Can I ask a question about that?
Susan, you had a question?
Oh, you're on mute.
You're on
Susan.
mute.
Sorry. I've never heard of a CAB bringing that up before. It's interesting. And I'm just curious as to their perspective.
I had to look back through my notes. Two CAB members that brought it up. One was a nonprofit service provider, but not dealing with the homeless population. I think just dealing with the Lower Manhattan community in general, had brought up what they have kind of seen happening in the news and also happening in and around the community, and also with the clients that they interacted with, how there was this rhetoric against kind of like having these services and providing these perspectives. NYP was very clear that we are a clinical facility that doesn't kind of wade into this kind of topics about like what belongs in the neighborhood and what doesn't. But they said, since we do service such clientele, it is something that they want to kind of discuss further internally with the CAB. So they're supposed to be organizing an internal CAB meeting, in January, which is outside of their normal schedule. But I haven't seen anything come up. But this is kind of what was reported out.
So it sounds like it's kind of centering around the need for provision of services.
Yeah, and housing as well too. So.
Okay. Larissa, I know you went to a CAB meeting, but you don't.
We don't have a lot going. That was on the agenda last month. It was fairly general. We did talk about the Judson 100-year celebration and the need for capital improvements at Judson. They need a lot of work on their second floor. So I know Dr. Gagliardi is looking to invite them back. The urgent care that they're planning on the first floor, that's on hold. There's a couple of alternative plans on the table. We want to make sure that the request for the capital improvements at Gouverneur are within the budget. So this coming meeting, we'll be working on our bylaws, but also looking at some alternative suggestions for the use of the first floor at Gouverneur.
Okay. Okay, thank you, Larissa. I'm going to give some updates on education, but before I do that, are there any other CABs? Susan, are there any other CABs? No, right? Like the Third Street.
Aware. Okay. Third Street is going to be February 1st. And the others, I think, they're all back in their facilities now, but I don't know that anyone's started having CABs other than Project Renewal.
Okay. So I'm going to give an update on the education stuff. We are going to be going back to the CEC meetings. Our rep Tati is no longer with us, but I've asked several committee members to take that up. Their CEC meetings also happen to be the same time as our exec, so it poses a conflict for some of the members who would go to a CEC meeting to represent us. But I emailed some of you or one of you about that, and you can get back to me later if you're interested in repping CB3 on the CEC. I mean, you don't have to be a permanent rep, but just at least going to some of the meetings. They start at 5:30. The next one will be on Tuesday, January 11th. And they do have a presentation from their annual presentation from the School Construction Authority, which I think will be of interest to us. And then speaking of school construction, we still need to follow up on the school at Essex Crossing, specifically on the land, we had some conversations with, I think, EDC and HPD, and they were very supportive about, this need for a school, but we need something in writing from them about extending the deadline on using the land for the school. So that's it. So that's for education. And also we received a notice from Department of Education about some hearings on a merger of PS19 and East Village Community School. So it's been going on for quite some time, and there are 2 hearings scheduled for January. So we I think we heard about it a little bit last year, but it's an ongoing issue and it looks like it's planned for next year, but the hearings are still happening. So we got a notice, the hearings are supposed to be in person. That was what the notice said. So I don't know if it's going to change to virtual or what. Maybe Laura has some information on that, but we can talk about it offline. But if anyone is interested in, helping us to keep track of it, that would be good. That's it. We also, okay, so not speaking of education, we are also going to follow up with the Allure group and the nursing home. As you recall, we're going to follow up with get help with following up with the Attorney General's office on the agreement to establish a nursing home for the beds that we lost at Rivington House. So that's all I have. Any questions on the updates?
Deborah has a question.
Yes, Deborah?
Hey, so it's not a question, just a sort of following up. I know that you reached out to me. I need to connect with you offline about the request to represent at the CEC1 meeting. So I just wanted you to know that I got your email, but I do want to talk to you about it, okay? Because I'd love to.
Okay.
Talk about it. Okay.
Okay, thanks.
Mm-hmm.
All right, if there are no other questions about the updates, we will have the last vote to adjourn the meeting.
There's one
Susan?
one member of the public. I don't know if you want to take questions.
Oh, Samantha Chan?
Yes. I want to express my disappointment with CB3 by passing this resolution without knowing the details on this project. This is a disappointment. With lack of details on this project and not knowing how they are going to spend taxpayers' dollars, we need transparency. We need to know how they're going to spend our money. I am a taxpayer. I have the right to know. Why $337 million? Why not only $3 million? Don't you think they have the duty to explain to us? What is the budget? Do they have a projected financial statement? How much is CFH's benefit from this? What is their annual income? And are there other investors involved? And what's their stake in this? We need to know as taxpayers. This is a disappointment. You guys are not fair. We selected you to represent us. Our voice needs to be heard.
Thank you for your comments. Okay, Heidi, are you ready for the roll call?
Sure. Bailey?
Yes. Here.
Thomas Rosa.
Here.
Larissa Scheinberg.
Present.
David Crane.
Here.
Eric Diaz. Shirley Fennessy.
Yes, here.
Deborah Glass.
Here.
Alicia Lewis Coleman.
Yes.
Laura Lugo.
Here.
Heidi Schmidt here. Ricky Wong.
Yes.
Carmen Perez.
Present.
All right, thank you.
Okay, so the meeting is adjourned. We'll see you at full board.